brief notes, tell you where we're at. So I will start from staff and move my way up. So we have 8 vacancies in our animal care team out of 17. We are looking at 4 vacancies on our client services team out of and we have 2 vacancies from our animal control officer team. The animal care recruitment, they have interviewed for the Tech 1 positions, and they're preparing to interview for Tech 2. They had a very strong pool for Tech 1 positions, and they were actually able to fill some of the Tech 2 positions from that pool. Have made offers. We thought we were going to fill most of those 8 vacancies, but we had some candidates withdraw because the county could not meet their desired pay range. So the county has a equity, we're following the pay equity law. So the HR does an assessment of where each candidate is in terms of how it compares with other people in that level and classification in the county, and looks at their experience and then recommends a pay. So from what I understand from HR is that this is not unusual for animal services or for DCS. It's countywide, that we are going through recruitment processes and then having candidates withdraw. It's a very competitive job market right now. Other organizations can pay hiring bonuses, which we cannot, because then we would need to do it for every position, or we'd have to bargain it with the union. If we're going to offer a signing bonus, we're going to have to go to the union and talk about, does that mean for every person in this classification or for every person in recruitment? So it is tough for recruitment, but we are not done looking at our Tech 1 pool. We're closer, but not as close as we thought we'd be. By end of last week, we thought we were closer than we are. Had a little backslide with people pulling out, but we still have a number of folks in that pool to interview next. And from what I understand, because we took out the education requirement as well as shelter experience requirement for the lower level animal care techs, we have a much more diverse pool. So it would be nice to see the demographics of that team become more diverse. It tends to be pretty homogenous. Tends to be white women applying for animal care positions. For client services and animal control officers, we are interviewing for all those positions this week, and I am on those interview panels. So I am in about 20 hours of interviews this week. And let's see, we're interviewing eight for client services, office assistant 2, and can't remember how many for animal control officer 2, but I think it might be 10 or 11. So crossing our fingers for those as well. And then when moving up the ladder, if you're going to think hierarchically, we also have a shelter manager position, which posted last Friday. So that's animal shelter manager. So that's the operations manager position, which is vacant right now, which I'm partially filling along with Andrew Mathias. And then the medical director position, which we created for the animal health team, which would be a veterinarian overseeing the veterinarians and veterinarian techs and veterinarian assistants. Created that position based on a similar position at Oregon Humane Society, and also looking at some medical grade positions in the county. We've created a draft job description because it doesn't exist at the county, and it has now gone to our classification compensation team in HR to be hopefully approved, and for them to assign it a classification and a pay range, and then we would recruit for that. So we are moving forward. Like I said, it's a competitive market. I don't know how long it's going to take to recruit for either the shelter manager or the medical director positions. We also are starting to move right now on getting a recruitment firm for the animal services director position. So I am anticipating being interim for, I think I already told you, through the end of the calendar year. But we are looking to contract with a recruitment firm because it's so challenging to recruit for animal shelter positions and zoo director positions. I know from my experience at Metro that we want a firm that is familiar with that field and how to get the word out and how to recruit good candidates. So we're getting that contract up and running now so that we can start start the ball rolling in terms of defining what we want, where they think they'll look before we need it, so that we'll have it ready. And we may be using that firm also just to look at some other high level positions in DCS. Because we are also recruiting for a finance manager in the DCS director's office, and that has been open until filled, and that has not yielded very many candidates. So it's, again, just really tough for hiring right now. It's an applicant's market. So if you're looking for a job, it's great news. But if you're trying to fill your vacancies, it's a recipe for patience and just like fortitude, and we're going to keep going. I think that's where I'm at with shelter staffing. Do you have any questions about that? No. Okay. You're muted, Dana.
Bad about remembering that. So we can find the descriptions online and share them with our networks. We could be helpful in that way.
Yeah, the shelter manager position, yes, that is open until filled. So there's no closing date on that. And what that means is we'll keep it open until we get a handful of good candidates to apply to interview. So yes, you can definitely share that. I don't know. I don't think the ACO2 and ACT positions are open, or OA2. I think those have all closed. But
Okay.
if they reopen, I would be happy to communicate to this committee if you would want to share with your network. So I think that's a great idea. I'm going to make a note of it myself. Okay.
Are you going to touch on utilizing Oregon Humane Society's EAS volunteers?
Oh, yes. Thank you. Yes. So, gosh, when they first started a few weeks back, I was hearing that it was taking, it was taking some training. It was kind of random because we weren't having the same people come each day. So it took some onboarding for each of those. And when you're short staffed, it's hard to do that. But I checked in with Dean, we have Andrew, who's our animal care operations manager, and then Dean, who's our animal care supervisor. And I asked him today how it's going. He said they're great. They're coming every day. They've been a huge help. They're doing the smaller animals. It's the dogs. Cleaning and handling the dogs is that we're reserving that for animal services staff just because it takes some more skill. But with the small animals and the cats, the Oregon Humane Society, EAS volunteers, emergency animal services volunteers, or emergency animal shelter volunteers, are apparently they are really a big help. So they're filling that gap, and I anticipate we'll continue to use them for the time being.
Thank you.
Oh, you're welcome. Any other questions?
Are you accepting new volunteers yet? Or is that still on hold?
No, we are accepting new volunteers. I just think it's a matter of getting them trained in vaccine attestations. I think that's it. I can ask Colleen where we're at, but I haven't heard that. What I've seen is that she's opening up more and more shifts for existing.
And that would be reflected in that Friday letter. Is that right? The newsletter that comes out, would that,
Oh, yeah.
would that indicate whether you were accepting volunteers?
It should, but I can definitely check with Jay to see, and Colleen, to see if there's anything that we'd want to put out there. Colleen, our volunteer services manager, she's been off and on in attendance because she's been having to take leave. And so she's been a little spotty in terms of when we know she's going to be in the building. So we've also just, I have to say, just with staff being so slim, the burnout ends up people taking more time because they're having some health issues as a result. So it's just, but I will certainly ask if that's something that we can promote in our weekly.
I had a question. I'm just wondering, is the shelter on social media? Just I'm thinking about the jobs and like if that would be easy to post and share that way.
Yes, actually, I approved Jay to do more ad placement with Facebook. So we are investing funds actually in spreading the word for the animal shelter position. And we will do the same for the medical director position. So he is he has volunteered to get more creative and kind of expand the breadth of where we're spreading the word. But if you see that there's some channels or platforms that might be a good venue for advertising, I'll take any suggestions and send them along to Jay.
I've also posted the job posting for the shelter manager position in the chat, and I've also posted the CVT position as well. Those are the only two that are posted right now.
Any other questions?
Mhm.
I'll give you a minute to look at that position if that's what you're doing. So that's the staffing update. My next agenda item was to share that presentation with you about the University of Wisconsin, but I first wanted to ask if you have any other general questions about the shelter and operations before I go into that.
I have a question just about what everything that you've had to take on, Carrie. So I know that you are the interim for MCAS. Are you still continuing all your duties as the deputy for community services?
I've scaled back, but yes, I'm still serving in that role. So when Jamie Waltz is out, I serve in her role, attending directors council meetings, and our equity manager for DCS has also left. So I am filling in for her as well. Just
Wow.
making sure that our equity committee meetings are happening and that we're getting ready to post for that recruitment.
Right. Thanks. It's just good for us to be aware of the load that you're carrying right now.
Thank you. I did take 2 days off, Thursday and Friday, but then I got, maybe I shouldn't say that on a live stream. I heard about it from an animal advocate, shall we say. That Terry
Right.
Stacy fiddles while Troutdale burns. But I'm very good at parking my job at the door when I need to. So I had a great trip to the coast and I did not look at my work email and I did not look at my work calendar.
For you. Good for you.
Thank you. Okay, so I'm going to share my screen so I can present this slideshow to you. Oh shoot, let me get into present mode first. All right. Oh my gosh. I shared on WebEx once before. Here we go. Okay. Okay. So you can see it, I'm guessing. Oh yes, okay. I can see you. All right. So let me pull up. I also have my talking points here. Okay. So part of this, Jamie and I shared it, so I may not be able to answer all the questions because some of it is historical, because I wanted to let staff know, like, how did we even start with the University of Wisconsin? Jessica, I see your hand.
I don't think right now, I don't think our live stream is set up to see. I just wanted to make sure that it caught up to make sure that this was going to be visible on our stream. Because I don't think it was
Okay.
originally set up that way, but I'm looking at it now. It looks like it caught up and it should be visible. So
Okay, so there's a delay. So I think I had shared with you last meeting that I had heard from staff that they really didn't know much about the University of Wisconsin and why are they making these changes and what's going on. So we had an all staff meeting on the 7th of April. Jamie and I had presented to the chair and COO crews the week before to a very positive response. And I wanted to give staff a chance to, again, have a better understanding of what we're doing and why. And we also had Dr. Sandra Newberry, who is the head of the shelter medicine program at University of Wisconsin, at the all staff meeting. So she was able to answer questions. And in the end, it was a really, really good opportunity for staff to just ask her directly, like, why are you making us feel bad? We didn't mean to do these things wrong. And she comes from a place of empathy and said that she has learned these things too. Like, she was relying on data that wasn't actually founded in science and what actually is happening when they did testing on the kinds of behavioral practices that we're moving away from. And I think it was a really good opportunity for staff to just have that chance to hear her and be heard by her. So I do feel like it was a bit of a tipping point with staff. But I'll give you your own experience. So this is about those organizational changes aligning with our North Star of equity and quality of care. This is the North Star. So the tagline is providing those equitable services to the public and ensuring high quality care for the animals in our shelter. But what that means is when we're talking about equitable services, that we're focusing on communities that may not have a positive relationship with animal control, may not have the resources or even knowledge about what it means to take care of an animal. And maybe if they're low income or they're challenged somehow, maybe they need some extra help so that their animal doesn't get separated from them. So that's all about that supportive resource-based approach, as opposed to a regulatory and punitive approach for equitable services. Our high quality operations this is very much what the University of Wisconsin is helping us do to become more efficient in the shelter so that adoptions are easier, animals are staying in the shelter only as long as they need to, and that efficient processes means that those animals are not in the shelter any longer than they need to be, because like humans, they don't thrive well in an institution. And then the culture change is about having that work environment where people really feel like their team is there for them, their leadership team is there for them. Safety, trust, and belonging is the commitment that the county has for all its staff. So by developing diverse teams, ensuring that we look like the communities that we serve and that we're taking care of each other, that is also a really big goal. I want people to enjoy coming to work and feel like it's a healthy place to be. So that's our North Star. And this is a motto now. It's like safety, service, and care when it's needed most. So I think that encapsulates a lot of what University of Wisconsin is helping us do. And that's one of our volunteers. So how did we get here? So it all began when we were looking at, we know we need a new shelter. The shelter's in an old jail. It was not built to ever be a shelter. So in looking at what kind of shelter do we want, this was before my time, but I think it was with Jamie and Kim Peoples, the former director of Department of Community Services, decided to look at what are the best practices in animal shelter design before we start designing a shelter. And that is what led us to the University of Wisconsin. The Department of County Assets allocated funds for a facility master plan. So DCS didn't even fund that. Because we're looking at a new facility, that DCA supported that initial planning and also supported how we're doing that organizational approach. And they're still supporting us today. So we have a shelter planning workshop coming up in August, and it's a combination of DCS and DCA running that process. And it's to have a building that meets the needs of those best practices in shelter medicine. So the University of Wisconsin Shelter Medicine Program team, they really are considered to be a leader. I think there are 3 shelter medicine programs in the country that look at that data that informs their practices. And we entered into a consultation partnership with them in April of 2019. And it did morph. Initially, it was, will you take a look at what we're doing because we want to do shelter, redesign, new shelter. But as we started to work with them, we realized that they could actually help us change our practices to get to that place. So the goal is to have those evidence-based recommendations. So they're looking at how we're doing our work, and then they're advising us on the changes that they've done with more than 600 shelters nationally and internationally to become more efficient and move animals through in a way that's humane. We are not paying a penny to University of Wisconsin. They have entered into this partnership based on the county and DCS's commitment to equity, because that is also a core principle of their shelter medicine program, as well as a data-driven approach. And Jamie Waltz coming from a public health background, really also, she already was thinking in terms of a public health model, and that's very similar to the model that University of Wisconsin is applying here. So they did conduct a site visit under that initial agreement and a review of the existing shelter layout and procedures. And then we evolved our agreement to look at changing the shelter model, looking at all those, everything we do, how we make our decisions, the information we use to make those decisions, how we're inputting them into a database, how we're categorizing them in the database. Like, it can be very granular, but the shelter model is, again, what they've done in 600 shelters across the world. So this is a tried and tested model that they speak from a lot of experience for what works. So that's the shelter model. We're also doing a pilot with them, with our field services team. So the pilot, along with the city of Chicago, has University of Wisconsin coming out and observing our field officers out in the field. How do they interact with the community? How do they interact with the team at the shelter when they come back? And they will be doing outreach with the community and asking the community what they want in terms of animal control or animal enforcement. There are communities that have very negative associations with any kind of enforcement, legal enforcement, law enforcement. So what do they want, and how would they see us as a resource? It could be some big changes. The University of Wisconsin will be working very closely with our field services team as part of this pilot. So I think of it as a co-creation. So these are two parallel efforts, and then the rest of the slideshow will go into detail about each of those efforts. So 2 efforts for that philosophy, the North Star, the shelter model, and the field pilot. So when we're talking about both of those efforts, the University of Wisconsin, they really are focused on equity and how we deliver our services. So ensuring that those interactions, no matter whether it's someone walking up to the shelter and talking with a person or encountering someone out in the field, someone coming to their home, that those are positive interactions, and that we are increasing ability for members of our community to have services. So how can we be more accessible? How can we be more understandable? How can we bring services to them when possible? And then that excellence in shelter care and management, which is just ensuring that every animal in our care is healthy and has an outcome sooner rather than later, so that they're not lingering in the shelter. So the goals for the shelter model, again, animals stay in the shelter only as long as they need to be. So that's different from some older models where maybe a animal had some behavior issues and we try to work with the animal in the shelter. And what we learned, or what University of Wisconsin learned by looking at the data, is testing an animal's behavior, aside from aggression. I mean, fear, anxiety, stress, that's going to be made worse by being in a shelter, and it's not going to be predictive of how they are in a home. Even an animal's behavior in one home won't be predictive of how they are in another home. So they're only in the shelter as long as they need to be, because we just assume that they're going to do better outside of the shelter in a home, in a placement. Maximizing that life-saving potential through efficiency of care. So it's checking in on every animal and prioritizing tasks for staff to focus on the animals that need the most help. And I'll let you know how some of these changes kind of translated into our practices. That our adoption process is equitable and accessible, and that upstream prevention is really giving those animal owners that may be challenged or under-resourced, giving them those resources early on so that, again, they don't end up with an animal running away or an animal being taken away, that they know how to take care of an animal so that they can keep that bond intact. So these are the areas of change for the shelter model, and we are only partway through, partly because of the pandemic, big time because of the pandemic, and staffing. And the University of Wisconsin has, they didn't want to overwhelm staff by saying, here are all the things we're going to do, because it's a lot, but we are like step by step making our way through these. So intake, so that's when an animal comes into the shelter. Daily rounds, which is when we discuss all the animals in the shelter. Animal behavior evaluation and planning, which is, when there is a behavioral issue, how can we evaluate it? What do we want to do about it? Pathway planning, which is what's the best path for this particular animal. Care planning is for medical care, medical surgery program. How does that operate efficiently? And then how do we handle animals involved in legal cases? So what we've already done is we've revised our intake process. So what used to happen is animal health would give a comprehensive health exam to every animal coming in. And what University of Wisconsin advised against is that's taking way too much time from our animal health team. And if there is no evident disease or injury, if the animal seems healthy, they don't need an exam, because that's putting them through a process that isn't going to benefit them, and it's taking time away from the animal health team that could use it focusing on the injured and sick animals. So now those healthy animals, actually all animals, are first looked at by animal care, and they identify when one needs to go to animal health. But if the animal is healthy, then it goes, starts going through the process outside of an exam. They receive that cursory exam to identify those obvious issues, and then it goes to animal health. Daily rounds. I don't believe that daily rounds used to exist. There was a euthanasia committee, which would just discuss like which animals need to be let go. What happens now is we talk about a lot of the animals, whether or not euthanasia is the topic. So we look at how long have they been here? How is their health doing? Longer term animals sometimes deteriorate from being in the institution. So looking at each animal and paying closer and closer attention to the animals who've been there the longest and finding those outcomes. Like, what is the outcome that's best for this animal? Is it being reunited with the owner? The owner may be challenging, but it's probably better than putting them through an adoption process. Transferring them to a rescue that might be better able to serve that animal's needs, or adoption. And we are also implementing targeted campaigns to promote adoptable animals. So that comes out of those rounds. So an animal that's been there for a long time or may have a specific behavior, we can promote and be more explicit when we're trying to find a home for that animal. And with Jay, our communications coordinator, I told you I've approved funds for him to pay for ads to post the shelter manager position. Same thing here. We're investing money actually in Facebook ads to do target promotions for animals that have been in the shelter for a long time. We've also, and this is the one of the changes that was really challenging for staff, revised our behavior evaluation process. So there used to be formal behavior evaluations of every animal. And like I said, it's just not predictive of how an animal behaves. It's just a snapshot in time. And Dr. Newberry told a really touching story about when she said she just remembers so vividly seeing a vet assistant coming down a hallway holding a puppy. And she said, "Where are you going with that puppy?" And the vet assistant said, "Well, he failed his temperament test, so I'm going to euthanize him," because that's how they used to do it. They had a specific test, and if they failed, they're not going to make it out. And the folks who developed that test finally tested the results of that test, and they found that it wasn't predictive of behavior. So we are no longer doing those. It's a waste of time, and it's also a huge risk that we are making decisions that are not well informed about an animal. But we do behavior journaling and monitoring and daily rounds. So if an animal does show some kind of behavior when they show up, whether we hear about it from an owner or from whoever brought them in, we'll pay particular attention to those. And our animal care operations manager, he has a lot of behavior experience, but we also have some staff that are skilled in assessing behavior and kind of seeing how they do in different situations without testing them. So it used to be like, well, let's stimulate or agitate the animal to see how they behave. That is not what we do. We're just observing the behavior and whether it seems to be getting worse or better with different enrichment techniques. So that's how we're addressing behavior with enrichment. So it could be toys or interaction with a human. We're going to start integrating more activities, which we haven't had the staff for, but will help, like play groups, dogs that get along with each other, with other dogs. We can start having them out in the play yard, 2 to 3 dogs. So there's different behavioral programs, enrichment programs that we're going to start reinstating once we have the capacity to do that. And then the last recommendation from University of Wisconsin is just to do some trazodone application with giving them anti-anxiety meds while they're in the shelter and then tapering them off when they're placed. Jonathan, did you have a question? I thought I saw your voice or your name pop up.
No, I accidentally hit something on my phone.
Oh, okay. I can't see everyone. So if you raise your hands, I can only see Dana and, oh, now I see Jonathan, but I can only see 4 people and 2 of them are me and Jessica. All right. So here's what's on the docket. So those are the changes we have made. In terms of intake, we would like to have a coordinated entry system. Right now we have 3 entrances, but we don't use them effectively or efficiently. Pathway planning for animals, open selection process. So open selection is really interesting. What it means is when an animal comes in, they have a 3-day period where they're considered a stray. Under ordinance, they're a stray, and we can't place them, we can't do anything with them. We have to hold them in case someone claims them. But what we can do in open selection is, let's say a finder brought an animal in and they're like, I'm actually really interested in adopting this animal if you can't find it. We can say, okay, and it's like we give them dibs. Or once we have the capability for people to really look online at photos, I mean, you can do it right now. They can say, I really like that cat that just came in yesterday. I want to adopt that cat if it becomes available. Right now, we can't do that. We have to wait for the stray hold time to elapse, and then we say it's adoptable on the site. But University of Wisconsin says that if you give people kind of that early access to say, I want dibs on that animal if they become available, it's a game changer in terms of moving the animals through the system. So open selection is a big step that we're talking about next. And then follow-up activities to daily rounds. I think that's enrichment based. What is that? I can't remember. Let me look at my notes really quick. So that's trying to resolve barriers to animals leaving the shelter. So I think that's just looking at what else do we need to do if there's something in the way of the animal leaving, and then evaluating and revising each animal's pathway as needed. So that's, again, part of rounds. Like, we don't really think this animal's doing well in foster, they're going to come back, we're going to try a rescue. I mean, it's really looking at what works for each particular animal. Then care planning. So this is, actually, we're very close to implementing this. So status is in Shelter Buddy, which is our database, we have 47 different categories of how we talk about them. And we're going to reduce those categories to 5. The status denotes the responsibility of who's responsible for doing the next thing. So it will basically be if it's oh gosh, I should know this better than I do. They've done so much work on it too, but I missed the all staff because I was in a budget meeting for DCS. So we're down to, Jessica, do you know off the top of your head the 5 statuses? If you don't, I can pull up my cheat sheet.
If you give me just a minute, I might actually probably have the presentation. Give me a second to find the slide for it.
I have a question while she's looking.
Yeah.
With these changes, how or does it change? Let's say, I'm going to use the word liability. Let's say you adopt out a dog that ends up not being able to assimilate to its new home, and maybe has some issues. What does it change the shelter's liability in any way, or the way that you present the animals to prospective adopters?
Yeah, no, it does not. Do you mean because we're putting a potentially risky animal in a home?
Yeah, if you haven't evaluated them as, quote, thoroughly as you used to, although that was a kind of a win-lose situation. But if you, I don't know, is there any statement of
I know what you're asking, I think.
Yeah.
So this is the other key point where Dr. Newberry was able to connect with staff. So this is related. It'll sound a little bit like a tangent. So staff are really upset sometimes when we euthanize animals, but they're also really upset when they think an animal is risky to adopt out and we adopt the animal out and it bites and it comes back.
Yeah.
And
Yeah.
so they'll say, we warned you. Managers don't understand. You know, we told them that this dog was not equipped to be in a home. But what Dr. Newberry said is every shelter has to weigh between two parameters, euthanasia and adopting out. So there are risks to adopting out. You could eliminate the risk by putting the animal down. So that is what the shelter review, the rounds discussion is about. So we will really focus on those animals where, you know, this dog ran after a dog, it tried to attack the dog, it didn't bite the dog. Do we trust this dog to be out in public with a family that may not know how to control a dog? Well, he hasn't bit a dog, so maybe it's okay. Seems to be doing a little better these days in the shelter, has calmed down a bit. So we might adopt that dog out. Or if a dog is has shown a predilection for being aggressive and maybe has bitten more than once, you know, on 2 different occasions in 2 different places, then it's really the behavioral person will make the recommendation to let that dog go. But it's really, I mean, those are our 2 options. I mean, a lot of rescues aren't going to take aggressive biting dogs, and there aren't a lot. I mean, this is something we can talk about too. Like, are there resources out there? Maybe the committee would like to research it. And Dana and I have talked about that a little bit. But yes, I hear you, Sally. It is a risk. Like, we either take the risk or we don't take the risk. So that's, you know, that's the really tough place that we can be in. That makes sense?
Yes. Yes.
Jessica, did you find anything?
I did, yeah. And I just wanted to note real quick, Jonathan put something in the chat. He said this is kind of old now and University of Wisconsin may have different opinions based on new evidence. But if you're interested in behavior assessments, this is an interesting read. And he put an article there, a link to an article there in case anyone is interested in that. And then as far as the statuses, there's stray hold, available for adoption, hold, protective custody, foster, and DOA. Okay.
So those are the main categories, and then we have subcategories under there. So you could have available for adoption, but in or maybe hold and then under vet care, or hold and waiting for vet care. Right now we have 47 different categories, and we use them all at the same level. So what we're going to be moving to is we have 5 main categories that Jessica told us about, and then you have the subcategories under there. So University of Wisconsin went through all those categories with us. We can't eliminate them from the Shelter Buddy website because that database works for lots of shelters. But what we can do is educate our staff about how to prioritize the statuses that they use to apply to an animal. And so the May all staff, Andrew talked about that with staff. We're putting cheat sheets together. He developed definitions for all the statuses and substatuses. We can share that with you if you like. And we were going to launch it last Thursday, May 19th, but Andrew realized that he should probably check with IT. So this is just a techno thing, but our website pulls from Shelter Buddy database, and they need to talk to each other. And our website doesn't know that we're going to 5 statuses. So it would have posted animals with error messages. So we had to postpone the launch date for this new status communication piece to June 8th. So IT is working behind the scenes to recode the Animal Services website to be able to understand the changes we're making to the database so that when people view the animals, it's accurately portrayed. Jessica.
I don't know if you were already planning on going over this, Carrie, but one thing that was really, really interesting that Andrew was talking about in the all staff meeting when he was presenting this to us that I think is part of maybe helps understand as far as like where staffing is coming from. Those statuses that we just shared prior to this, we had 82 of them. And the sub statuses were unlimited, and we're going to be going to just 16. So really big difference internally on our end as far as how our system works.
Yeah. And it reduces a lot of room for error in how people are defining those things in their own heads, right? Because we have animal care staff applying statuses, we have field staff, we have client services, we have animal health. So we are all getting on the same page. That really is the main goal with the status communication. Thank you, Jessica. And then the second main bullet on this slide about the medical surgery program, that it would be guided by the open selection process. So that means once we do give the go ahead, like, yes, people can put dibs on an animal while they're in stray hold. That means that, let's say you have 9 animals on stray hold and 4 need surgery, but 2 are under open selection, and 2 animals, people have already said, I'd be interested in that animal. Those get prioritized for surgery. So it's helping those animals get ready as soon as possible for those interested adopters. So that's coming up. We haven't implemented open selection yet, so not ready for that quite yet. And then animals in legal cases. So this is a very strong recommendation from University of Wisconsin. We are already evaluating the welfare of those animals that are in our shelter, but it's also looking at, is this the best way to handle those animals? Dr. Newberry she's very concerned when we have animals that have been in our shelter for 1 to 2 to 3 years, they become institutionalized. They're all by themselves in a kennel because they've gotten wrapped up in a legal case and now they're evidence and they need to stay there until the case gets heard, and the courts are so full, the court dates keep getting pushed out, that she would just like us, that is not how we should be handling animals. It could mean changing our code. It could mean changing the law, but it's just not in the best interest of animals to be holding them the way we do, as required by law, but it's still not okay. So how can we set limits for housing them in shelter? We foster them out when we can, but if they've shown aggressive behavior, we have to keep them in the shelter unless we can find some alternative. And then again, just making sure that we're looking at their behavior and monitoring it to ensure that we're providing them what we can. So that's the shelter model. This is a really big flowchart, but we have partnered with Oregon Health Authority's Program Design and Evaluation Services. It's the evaluation arm for the Oregon Health Authority, and we have an IGA with them. So we're not paying for it. They are helping us evaluate the changes that University of Wisconsin is making. So University of Wisconsin, their method is to come in, look at what we do, tell us what to do differently, train us on how to do that. But we want to measure the impacts and outcomes of that. So this is PDES's draft model of how we would measure. So you see on the right-hand side, very right-hand side, those are the long-term outcomes. That we're more efficient, we've improved our animal welfare, we have increased equity in how we provide our services. The short term, reduced LOS is length of stay. So again, we want the animals to be in the shelter as long as they need to be. We'd want to see that length of stay going down, that we found placement for them sooner than we did 3 to 4 years ago. That we have improved care to our sheltered animals, and then fewer healthy exams. I think, I'm not quite sure what that means, but I'm meeting with them on Thursday, so they'll explain that to me. But this is not to go into depth. It's just to let you know that we are planning to evaluate all these changes so that we're not making them just to make them, but we want to be able to tell the story of what the outcomes that we have that are different and better as a result of this work. So that's in progress. And then the field services pilot, moving into that other piece of work we're doing. So this is a paradigm shift. This is, again, moving away from the regulatory punitive, the dog catcher kind of mentality, that this is really about how do we proactively provide services. Oregon Humane Society is already doing it with the new complex that they'll be opening in the fall to create that teaching facility to provide low-cost services, and really hoping that we can partner with them on that. And then again, providing supplies, education to owners that need it. And it is similar to what the Department of Community Justice Juvenile Services Division is doing. They are also looking at reducing length of stay for juveniles who are in an institution How do they keep those kids with their families? What resources and services do those families need so that their kid doesn't run away or their kid doesn't get taken from them, that they have more support from their county government to help them maintain that bond. So it's a very similar approach. The vision and goals, again, is that equitable distribution of services, that we're paying particular attention to the communities of color who have been underserved by government in general, but I would say also by animal services, and that we're looking at neglect differently from cruelty, because neglect really can be about a lack of resources, a lack of education, a lack of awareness. It doesn't mean a lack of care. It doesn't mean that that person doesn't love their animal, want to take good care of them. So it's how do we provide those resources and eliminate any barriers that people might have to getting those resources from us. And the approach they're
Carrie?
using. Yeah.
Sorry, I just had a quick question about that before you move forward. But just in my experience with the services that are provided to people who are, more marginalized, the services tend to only be provided if they're willing to spay or neuter their animal. And I'm just wondering, is that also the case in this pilot, or is that, yeah, I'm just wondering if that is.
That's a really good question. I feel like this is only just starting. I feel like everything is up for discussion. I mean, that's how I'm approaching it. And I do know that we're going to eliminate the requirement. I think we already have, or we're going to do it. When people are interested in fostering, there used to be a requirement that we would not let them foster one of our animals unless all their animals were altered. And that is no longer going to be the case. Like, the animal that we provide to them will be altered before it goes into the home, but we're not going to require them to alter their animals. So because that's a barrier, right? It's a barrier to foster. It could be a barrier to adoption. I think those things are really all up for discussion. And I do see it as a barrier.
Okay. And yeah, so for the communities that already have their animals and say they want or they're needing food to, I'm specifically like talking about like houseless people or, just they already have their animal, not necessarily from the shelter, but they are needing some services or whatever resources.
We wouldn't require that they be altered to serve them.
Okay. Okay, great. Okay. Thank you.
Yeah, you're welcome. Okay, so participatory program development, this is really just about co-creation. It means that it's not University of Wisconsin coming in and saying, field services, we've observed you and we think you're doing it all wrong. They're working with field services, but they're also working with the community. So we've been in discussions with them about how would they have either a staff person or contract with a local community-based organization to be able to get the community input to inform this part of the program. So they're working on that. Community input is very high. It's just how do they do it? Because this is a pilot, that they're new to this. And we've connected them with Verde, which is a local community-based organization. It is focused a lot in the Cully neighborhood, but is very much focused on giving marginalized communities a voice. And they've done it around parks and kind of neighborhood structures, but they have a really good community involvement model that was very attractive to University of Wisconsin. So we're still designing that. But again, it's about working with our field staff, with the community to define how we want to do things differently. And then this is the rough timeline. So they've already started doing in-field observations. They'll start documenting community members' perspectives once we get them hooked up with a way to do that. Then they'll look at what's missing, what needs to change, work with the community to develop those new services that would serve them better. And then in August of 2023, start to make those happen. And then the evaluation scope for that, this is PDES again. So you saw their flow chart for the shelter model. They would also be looking at the field model as well. So The scope for that evaluation is intake, behavioral, community-based, participatory outreach. They would be looking at all those things and helping us evaluate it. And what we do want to see is, have we achieved efficiency? How have we affected short and long-term outcomes for animals and their owners? And how has the shelter experience changed for the animals? And how has it affected our culture and staff experience? So looking at all the angles of the changes, again, not making changes just to make changes. These are potential metrics. And again, we're meeting on Thursday to talk through this. Whether it's shelter capacity, do we want to do follow-ups with animal placements to see how they're going? GIS mapping could give us some zip codes and kind of a better idea of maybe where some low-income neighborhoods are that we'd want to focus on. Length of stay I talked about. Staffing levels definitely impacts our ability to provide that capacity of care. So that's also important. And then they'll be talking with staff and looking at staff retention as well. So that's also an issue. I think I may have mentioned, I think we have lost some staff because they were unhappy with the changes that University of Wisconsin is making. But my hope is being more transparent will kind of alleviate some of the anxiety some of our existing long-term staff have about the changes. So that's the presentation. Did I stop sharing? No, I didn't. Stop sharing. Okay. So that is the story of University of Wisconsin. Any questions?
I think I have a lot of questions about a lot of things just because I'm curious and want lots of detail about all of these things. But I think I'm just going to get more information over time, and as specific situations come up, I'll ask more questions.
Sure.
I appreciate how all the information was organized. And I wonder if we could get a copy of the slideshow. That would be possible, because it would be great for me to be able to refer to that.
Yes. Yep. Thank you for listening to me talk a lot.
Harry, with COVID and with having everything shut down, I know I've really lost touch with how many. Let's just take dogs. How many dogs do you have at the shelter at any one time? And what, I mean, capacity, or what's the usual, or I'm just curious. You know, having it all shut down, it's like it almost didn't exist for 2 years.
Yeah.
But
Well,
obviously it did.
Yeah. I was also going to share, I was looking at our agency monthly report for April. I mean, I can tell you at any given time, I think we have about 60 dogs. That sound about right, Jessica, from rounds, usually? Yeah.
Right.
But in terms of like what we took in, so in the month of April, we took in 171 dogs. We took in 10 puppies. We took in 78 cats and 41 kittens, and then 14 wildlife and 31 other, just like rats and hamsters and things like that. So it's a total of 345 animals we brought in April.
I don't think, I didn't know that. I don't know how many people know how many animals come in, you know, for whatever variety of reasons. I think you should somehow, we got to get you out there tooting your horn, because that's phenomenal.
Well, this report gets posted, but you know, I could send the report to you as well. It shows how many animals are in foster. So we're not taking care of all those animals, right? Some of them are in foster. And then we'll also tell you the percentage of outcomes. So
So they don't all stay
April-
there. Yeah.
in April, we adopted out 108 animals, which was 30%. 31.8% were reclaimed by their owners. So those were lost or maybe separated animals, and most of those were dogs. 27% or 97 animals were transferred to the Oregon Humane Society or rabbit advocates. We have way too many rabbits. We have like 42 rabbits in foster right now and 14 rabbits on site and they're all in quarantine because of the hemorrhagic virus. Like, we cannot take any more rabbits. We can't even transfer them because the rabbit advocates are full. Anyway, 27% were transferred and then 7% were euthanized. So that's the April stats. But I can send this to you too if you think that would, just kind of a snapshot for April, but it would give you an idea of where we're at.
I also posted a link in the chat, but on our website, if you go under Stay Informed and click on News, these monthly reports get posted on our website there as well. And that's where I put that link in the chat as well for everyone. And I can also email that out too.
Yeah, so that it's right there. What I just showed you should be there. And it goes into more detail too. Volunteers.
And Carrie, if you'd like, I can shed a little bit more light on that healthy exam thing from the flow chart as well. So in the past, we would, as animals would come in, we were required to do like a full exam on every single animal that came through. The suggestion from the University of Wisconsin was to do kind of a quick exam right at intake to determine if more health services may be needed or if they appeared to be a healthy animal and just move them through the process. So that's what they mean by less healthy exams. We've got animals, a lot of animals that are coming in that are already healthy that don't need a full head to toe, nose to tail exam.
So that's what the measure would be, that we're just doing less of them. That's helpful. Okay. All right. We're at 7. I took a long time. I was supposed to be done with that by 7:15. Any more questions? Because really all I have more to talk about is recruitment and to show you kind of some potential projects. So happy to answer any other questions you might have. No? Okay. So what's next for the committee? You have recruitment, and we could talk about that, what that looks like. Or Jonathan, I don't know if you'd want to wait and think about how you'd want to bring it to the committee. I mean, I'm totally open to how you guys want to talk about recruitment.
How many members are we down right now? 5?
You have 12 seats and 7 are filled.
And correct me if I'm wrong, we need to fill 3 of them, right, at this time? Or 4? How are you doing that because of the tiered system now?
Oh, yeah. I'm going to let Jessica answer that if she can.
We currently have, well, we had 4 vacancies, and then Nicole actually resigned as well recently, so now we have 5 vacancies.
So I'm trying to remember what we put in the bylaws here. So someone can fill the rest of her term, right, and then still be eligible for 2 terms. So we have 1 recruitment for that, and then we have 4 for just regular recruitment for their first term.
Mm-hmm. That's how I understand it. I just have a question around the timing of recruitment, in that I think we have maybe a little bit more work to do to have some clarity about what our mission and roles are. And so we could recruit, wise people to assist us with that. But it's also really helpful with recruitment to have some solidity around that.
Yep.
So, so just a little bit more conversation about that might be helpful.
About what you want to do as a committee?
Yeah, about what our roles are, if people come on, what are they doing? What would be the time commitment? How would they be helpful?
Right. So that all, I feel like, becomes interrelated. I mean, the time commitment, oh, right. Like, is it 2 hours a month or, right?
Are they going to be on committees? Do they have functions outside of the meetings?
Right. So when I was looking
Something
at
else
the
to
bylaws,
consider.
Go ahead, Jonathan, sorry.
Sorry. So I've been through this a couple of times now. This process can take like 60 to 90 days. So if we don't start at least advertising for the position to get applications turned in, you're going to be like into the middle of fall before we can even fill those positions. So I think it might be best if we at least start. Obviously, you guys are in recruitment of your own, so obviously a lot of those same resources are going to probably apply to looking for community members to join the committee. But so traditionally we've gone through a process where you advertise and then you open up applications for however long, right? And then we review the applications, I think in 2 teams, and everybody scored them in the past, and then the director and staff then reviewed and then we did interviews. At one point in time before COVID, we did the interviews. And then during COVID, the director did the interviews. So it's actually quite a bit of work. So I agree with what you're saying. At the same time, if we need to start doing some of that work at least, otherwise it's going to be a year before we have more people.
That makes sense to me. We sort of do the things simultaneously.
And I'm fine with the committee doing the interviews. I don't need to do the interviews.
Yeah, in the practices document, we tried to do some clarification around the recruitment process because there was a little confusion about how that operated. And so, I mean, no one, I don't think, is wedded to what's in that document because it hasn't actually been discussed and approved, but just to have some clarity around the recruitment process as we dive into that.
Yeah, there's a lot of detail in this practice document.
I might be able to
I
reach out
definitely think
to Jay and see if he still has the last recruitment posting that we did, if we want to review that and see what it says.
Yeah, because I think that he ran that through like your community involvement and all that stuff to make sure that we were being inclusive, and of course still ended up with almost all white people. So obviously it would be good to try to reach out to other communities to get some more diversity, but if it passes any evidence, it's still going to be a struggle.
But we could maybe use our networks that are in community-based organizations of color to begin to sort of use our own reputations to try to secure more candidates.
Well, at the bottom of the practices document, there's a work beyond meetings, and there's a bullet under there about create partnerships with community-based organizations to better serve their constituencies. I mean, that's something that sounds like the committee was already thinking it could do.
Again, that document wasn't well discussed.
Okay.
Yeah.
Was that something that we'd want to do at a future meeting, is to talk through that document?
It would be helpful.
Okay.
I guess the better question is, what is the, what would you consider the status of the document? Is it like half done? Is it revised now? Because I know you had gone through a few revisions.
I think it's,
do we need to review it?
Yeah, it's much simplified and organized, and all the questions are taken out of it. So I think it's at the point for committee review.
Okay.
Okay. You may have sent it out already, but if you send a copy of that so we could maybe, look through it and make any notes that we have, and then we can take a look at it maybe at the next meeting.
Yeah, I think that's a great idea. Because I'd heard very clearly from you last month that you're tired of just hearing stuff and you want to help and do things. And I didn't know until just now that there's some ideas at the bottom of this document about potential work that the committee could do. And it aligns too with what I was thinking. So I was thinking, some ideas that I had here, I'll just share my screen again. I just have 5 bullets, and this was really off the top of my head because didn't have a lot of time.
There was also a comment from Tracy that said, I think posting at the library would be good too.
Yeah. Oops. So let me make this bigger. It's probably too small. So these are some things that have just come up in my 3 months in this position. I would love to do a review of how much we charge people in fees, because I think some of those are definitely a barrier and are not conducive to having good relationships with underserved communities. So fees for impoundment, we charge people by the day if we have their animal here, like for food and board, basically. Adoption fees, licensing fees. I have a research evaluation analyst in the director's office who could help with that, but I think it's a matter of like looking, like maybe it's looking at what other shelters charge and what is really affordable for certain communities. Another one is researching dog trainers or behaviorists or resources for aggressive dogs. And this really comes out of a conversation I have with Dana. Like, are there resources out there that would give us a little more leeway in, because that's basically when we euthanize an animal for behavior, it's usually an aggressive dog. I've heard from animal care staff that we don't have enough resources for pet owners on our website. I think that's another maybe area that if someone wanted to do research and maybe some culturally specific research that we could post resources on our website, that would be helpful. Another is how can we support clients getting to our facility in Troutdale, because transit is not the way to go. And we have people walking down that Columbia River Highway where it's 40 miles per hour, carrying an animal. You know, it's just, it's not safe and it's not accessible. I don't know if it's like stipends and Uber. I mean, are there other ways for people to actually be able to get to our facility if they don't have a car? And then eventually, I want to have a PR campaign about the University of Wisconsin changes once we've made some more impacts. And I would love to have the committee's involvement in designing that. So these are just some ideas. I can share this with you too as we send out the other things you've asked for in the meeting today. But
yeah, great.
Yeah, thanks a lot for those ideas.
On the behavior portion of that, what do you have something specific in mind that you're looking for as far as resources?
It's like biting dogs. Like, are there, and it's really only because like and if it's something that you'd want to research, we can give you more information about, like, here are some examples of dogs that we had to euthanize because of their behavior. And it's, you know, they're aggressive, they run after other dogs, they run after people. Like, is there a way to handle those dogs so that they can be safe in public? You know, some people are like, there's got to be a way. Maybe there is. We don't have the resources ourselves to do it. And again, there's always that risk, but are there rescues out there? Are there trainers that, like, if we had a stipend for a low income pet owner with an aggressive dog, if we could say, look, here's a stipend of $250. Here's a trainer that actually works with aggressive dogs. I don't even know if it exists, but I thought, you know, if it's something the committee would want to take on and just see what's out there, or maybe it's something that we develop. I don't know. But that's when we, like I said, when we have to euthanize a dog, it's usually for behavior. I mean, for behavior, it's for aggression.
Mm-hmm. Are you guys still doing any kind of a behavior modification program there? No.
No, that's what we're moving away from, right? So we're moving away from it because it doesn't work in the shelter. When we're trying to modify behavior in the shelter, it doesn't work because they're in a shelter and they're being like, they have all this disruption. They're around, maybe if a dog doesn't like other dogs, they're just going to be anxious and aggressive already because they're surrounded by dogs. So if we had a foster or an owner, you know, and I'm just throwing this out there, like a trial period where they worked with a trainer but had the dog in their home. So we know the dog's in a secure enclosure. It's not around other dogs. It's getting really intensive behavior rehabilitation with an expert. We can provide a stipend. I don't know what it looks like, but I just know that's a real pain point for a lot of people when we can't adopt dogs out.
Mm-hmm. Conversation just makes me think about recruitment and thinking about the sort of criteria we might set for ourselves in terms of who we're looking for. Like when we're trying to recruit for a board of directors, we might recruit for specific skills or specific communities or specific geographic areas. Board directors, we recruit for money as well, but are there, do we want to be, I know we always feel like it's difficult to recruit and just to get people to sign up, but I think actually more specificity in making the case that you are the person that we need and this is why, I think really assists with recruitment.
I think you're right. And I think it's taking a look at what the strengths are of our existing members, saying, look, we've got someone who can write, we've got someone, but what we really need is someone who can get out in the community or has connections with the community or knows how to research animal behavior, whatever it is that we want to prioritize. I think that's a great idea, Dana.
I think the problem in the past has been that no matter what it is that we say we're looking for, we pretty much get the same thing. Because I think in my recruitment, I think I was like the only guy that actually came in. So I'm here. And they were looking for people who weren't necessarily involved in the animal community. And pretty much everybody on the committee is involved in the animal community one way or another. You have pet shop owners or other nonprofit people. And so I know in the past we've tried to include people who maybe don't know very much about it to try to get more perspective, but those people just have not actually applied for the position. So I don't know, maybe it's a conversation to have, are we going to look for something more specific in a broader, like people who are involved in the animal community? Obviously we can, still advertise people who aren't, but knowing that that's likely not going to be the people who apply, maybe we should try to broaden the people in the animal community that we are looking for. Or maybe like some kind of criteria that we're trying to, we don't have 4 people who all volunteer at the animal shelter, other animal shelter like I do, right? That we at least, they're spread out in what they do in the animal community, maybe. Just a thought.
Right. Yeah.
Well, actually, I have no experience in the animal community other than I have owned probably 35 or 40 animals in my adult life. That's my involvement, and my true love for animals. So I have had to learn. I mean, I have learned a lot over this last couple years, and I came in right as COVID hit, and there was a point at which I thought that it wasn't, my inquiry wasn't going to go anywhere because it had been such a long time from when I had answered the ad to when I actually talked with someone. But so you got one that doesn't have much animal experience except getting them out of the shelter, So
I stand corrected. I think I also haven't seen many of you since you joined the committee either, right? Have all of us even been in the same room?
no,
No,
went
never.
right into COVID. Yeah. So it'll be fun to meet everyone. So, I think it can appeal. My driving force was that, one, I was retiring and I finally had the time to do some of this, and 2, that it was just to share love of animals and how could I give back and contribute, to them. And I'd gotten, I think 4 or 5 of them had come from the shelter, so we had very, very good experiences. So, so I think it can appeal. I think you want a little bit of that balance.
Instagram. Interesting. Okay. I see that, Tracy.
So yeah, I look forward to talking in more detail about recruitment next time. It's getting kind of late, but I have lots of other ideas. I'd love to hear ideas from everyone.
So the main subject sorry, Jonathan.
I was just going to say, I think that's something we could also email between ourselves about outside of meetings.
Oh, yeah.
Right? That's what our thoughts are for the recruitment.
Mm-hmm.
Okay. Yeah, Jonathan, you could get that going and then we'll talk about an agenda and you can start to set the agenda.
Thank you again, Jonathan.
Yes, thank you so much,
Yeah.
Jonathan.
Not a problem.
So we have a few minutes left before 8. Is there anything else you would like to discuss or throw out there before we close?
So you're going to send us several things, right?
So what I'm going to send you, I'm going to send you the slideshow. I'm going to send you the practices document, and I will also share the cheat sheet for the statuses, just so you can. Or I may send you the. I'll either send you the cheat sheet or the slideshow from the May All Staff that talks about the statuses and how we're doing it. If you want that much detail. Am I missing anything?
Could you, maybe Jessica, because I'm not quite sure where I put my stuff. Could you send us the, what's the document that outlines the particular not positions, but yeah,
The practice.
practices.
It's just CAC practice is what I've got.
Okay.
Yeah,
That's
make
like-
sure you have the latest one, Carrie. It's the
I have the one that you had sent me, Dana, and that's the one that I had emailed out. There's a lot of attachments in that email. It was on
from January.
yeah. There's
But-
one that's more recent than that. That's a much cleaner document.
Oh,
So I'll make
I have
sure
a
you
6-page
I'll make sure
one.
you have that.
Okay. The one I'm looking at is 6 pages long.
Good.
Might be the right one. I'll make sure that you have the cleanest one.
Yeah, it was the one the most recent one that you had sent me, Dana. But if you want to send that to me again, just to make sure, that would be great.
Okay.
Okay.
Thanks. Yeah.
So I've got three things we're sending you, and then I will give Jay a heads up that we'd be interested in seeing whether volunteer opportunities are being promoted in the weekly, and that we might want to look at other ways of advertising on Instagram and for our recruitment for this committee. Okay. Anything else?
Covered a lot of ground.
Thank you.
It's nice to see you all.
Thank you.
Thank you very much. Thank you for your service.
Thank you.
All right.
Thank
See you
you.
next time. Bye.
Bye, everyone.
Bye.